One of the many harms that I think COVID did is people want to know exactly what virus they have and don't understand that by and large, it doesn't really matter. Urgent cares previously would do strep because strep is a bacteria and you would need to be started on antibiotics. Influenza sometimes mattered if you are a high-risk group, if you were within 48 hours of symptoms, if they would start Tamiflu. But even within that, people don't really understand what Tamiflu is for. Studies have shown that Tamiflu can maybe give you 12 to 36 hours of fewer symptoms. I like to say if you were going to be sick for 5 days with the flu, you might be sick for 3.5 or 4 days instead of 5. There's obviously nuance within there. If they're a baby less than a year old, if they're a high-risk group, if they're immunocompromised, if they have cancer, then the IDSA guidelines, like the International Nerd Society of Infectious Disease Doctors, says that treat them with Tamiflu, even if they're greater than 48 hours after symptom onset. They are a high-risk group. But sometimes people come in and they're like, is it adenovirus? Is it metapneumovirus? Is it rhinoenterovirus? By and large, I don't care. Oftentimes it's an education issue. They don't understand that whether what kind of virus it is, my management is not going to really change. Fever control with Tylenol, ibuprofen, stay hydrated, whatever. Or it can be coming from a good place, right? Like I have a spouse, sibling, parent at home and they're immunocompromised. I want to see if I could expose them to something. And usually I tell them, you're sick right now. You have a fever and a cough and a runny nose. Like I don't think you need the label of something like it's adenovirus positive to prove to yourself that you're sick. You came here because you're not feeling well. And if people want a respiratory pathogen panel or a mini swab that does like RSV, flu, COVID, sure, like I'm not gonna really put up a big fight about that, but I think it's an issue where someone goes to an urgent care, they generate one copay, right? And they're not satisfied by that answer, then they come generate a second visit at an ER. It kind of bloats up the system.